Today we're going to be blood testing goats for pregnancy.
Oh. Oh.
So here I've got some these 20 gauge needles. We've got 3 ml syringes. Anybody can do it. Just make sure you watch videos or look up diagrams. I'm doing the jugular today just because it's a big, easy to access vein. It's an easy place to get a good little volume of blood. The most important thing is just knowing where the vessels are, knowing where important things are, so that when you are getting blood, you're avoiding unsafe areas, but you're also going to poke where you know the blood should be. So the blood tubes here, we're going to mail these off. We're going to use Sage Ag Labs. You just mail it, and then they should email us the results in just a week or two. It is the holidays right now, so it may be a little bit longer.
By the way, we are in no way sponsored by this
We're not
lab.
sponsored by anything. It's just.
But if you want to hit us up.
Want me to do it?
You can also use Sage Ag Labs. When you send the pregnancy test, you can also send off tests for CL, CAE, and Yonis. And those are important. We're not doing this today. Today we're just doing pregnancy tests. But we'll do a video later on some of the other tests. It's the same process. You get the blood, you can send it off and have them test for everything at one time if you want. But it just depends on what you want to do. One, you want to make sure you have all of your stuff prepped. You want to have everything here. You want to have your needle with your syringe on it. You want to make sure your syringe is twisted on or pushed on tight depending on the type of syringe. You want to make sure there's no air, so the plunger needs to be fully pushed in like this. You don't want to have it like this when you go in, but you don't have any air in your syringe when you go in there, because if you inject air, then that can cause an air embolism, so you definitely don't want that. So then for the jugular draw, they have their sternum there. You want to push on whatever side you're going to try to get blood on. So you just push there, that holds off the vein like they do when you go to the doctor and have to get blood drawn. So you hold it off, and then you can, in the center they're gonna have their trachea, and to the side there's gonna be the jugular on both sides. So you can push and then feel for it, and you'll feel it feels like a really thin little water hose under there. Push on it and it'll bounce back. It'll hold its shape. And then you can just go in. Usually you want to go bevel up, so you want to have the hole of the needle on the end pointing towards you. You want to go in and then just pull back. You don't want to push in at all. You just want to pull back. When you get enough blood, come out and then apply a little bit of pressure on that spot. I am putting pressure on her thoracic inlet, wherever it is, don't know. And I'm just feeling for her jugular. So the jugular vein will rebound when you press on it, it bounces.
Look at her like still eating while we're...
Did you hear her?
Yeah, blunt. There it comes.
Like 2 mils, that's like a half a mil.
Oh. Here. Fart. No, it was me.
Did he? Hey,
Got
Hayes.
her. Yeah, girl. I gotcha.
For down.
Here, I need her horns hung on my foot. Not my foot, my jacket.
I'm also checking their Famacha scores while we've got them down, while I've got them over here. So far everybody looks good. Her face is like... I'm gonna get some dewormer for her.
Woohoo!
Ma'am.
You
The
can get
Producer's
these
Pride?
syringes off of Amazon. They're just vacutainers. I don't think they're EDTA or anything like that. They're just, I don't know that they're...
What about the syringes?
This is cat serum clot activator. The syringes are from Tractor Supply. I got 20 gauge needles and 3 ml syringes. So that one's pear over there. Okay, so this is a dewormer. This is actually a horse-based dewormer. There's lots of different things you can use. I'm not going to provide any suggestions on it because I'm not a veterinarian. But we're just using some Tractor Supply horse dewormer dosed for a goat. So that's what we're using.
She gives it to me quarterly as well.
This is a snack. It tastes good.
Here.
It's a good one. So with goats, you really don't want to worm them on a schedule. You want to worm them when they look like they need it, and you want to rotate your dewormer. It's helpful too if you can have a fecal test done somewhere, so you can just send it out, or you can call your vet and have them do a test. You want to make sure you're treating for what they have. You don't want to treat just randomly. Goats are always going to carry some amount of parasites. You just want to keep it at a manageable level.
Get over here.
God, she's so strong. Quit, Mom. Oh, watch the horns.
Amazing, amazing, amazing.
Wow,
can I let her
amazing
go?
thing
Mama.
with hair.
Can you hold it up again?
Abby.
Oh, she's scared. She's like, my life just ended. We are also going to be doing some urine tests today. These are on-site tests so that we can get the results on these today and know what's going on. The urine tests that we're using are supposed to be used at 45 days or later in pregnancy, so since the time they were bred or exposed to a buck. The blood tests said that they are accurate from 30 days on. So the urine tests, we're not super confident that any of those are going to be positive, but we are hoping that some of the blood is going to be positive. Alright. It's really clear. I don't know how much blood you need for this test, but it's always better to get as much as you can fit in the tube. Obviously you don't want it to be overflowing. Usually you don't want it to go past the label. But this one should be plenty. The other one should be plenty. I'm a little concerned that this one is not going to be enough because it's like nothing. But we'll just see what they say. They might be able to do it since it's just one test.
So then you just pop these in the envelope, send them in the mail, and...
Yep, so we're going to put these in an envelope, send them off. The pee test we will do in the car because it has to be room temperature. And I'll try to get a video probably on my phone for that one. And then... Oh, I'm so cold.
Y'all gonna do that one on the way home?
Yeah. Which I doubt it'll be positive. But that pee is from Pear. And I'm glad we got good blood on Pear. So that way we can compare the efficacy of both. See if one was positive and one wasn't. Over our needles off. You want to be careful when you're recapping anything because that's one of the most likely times you want to stab yourself. And there are some diseases that goats can have that are zoonotic, so they can be passed to people. So we want to be really careful around blood. I meant to wear gloves and I forgot. Does that say none as I do? Now I'm just cleaning up. I want to make sure I don't leave anything. Started the pregnancy test. I was too impatient to wait until we got home. It said to keep it at room temperature and out of direct sunlight, so I'm shading it with my hand. And we're in the truck, so it's a lot warmer. It was super cold outside, so we couldn't do it out there. But this is Pear's pregnancy test. So we're just gonna sit. We've got like 8 more minutes. We're just gonna wait and see what color it turns. This is the little key here. So if it stays blue, we know she's pregnant. But if it turns white, she's not. Be right back. Alright, so we have our results. It's the 10-minute mark, so now we can check and see if Pear is pregnant. And it's
So she is